Hi, everybody. Dr. Daniel. And today I'm talking about the subject new migraine drugs do not work as well as triptans. Sadly, the new migraine treatment drugs do not work as well as triptans. The triptans came along in 1990 with introduction of 6 milligram subcutaneously delivered sumatriptan, which the American Academy of Neurology has concluded is the best drug of the triptan group. As time went on, 7 oral drugs, 1 injectable sumatriptan, and 2 nasal spray delivery systems, sumatriptan and zomatriptan, were developed. The fastest drug delivery was subcutaneous sumatriptan, with nasal spray sumatriptan and zomatriptan nasal spray second, followed by an oral drug delivery. A recent study has found that newer developed acute therapy drugs for migraine do not work as well as the triptans. The new medication drugs for migraine considered for this study are the CGRP inhibitors Nurtec, Ubrelvy, and Rayvow. New migraine acute treatment drugs that were excluded were Trudisia, which is dihydroergotamine, which has a new mechanism of nasal spray injection of DHE, and that's a drug that's been around a long time with good migraine effects. There's another drug that was not reviewed was Alexibeb, which is Colcibeb, which is an NSAID delivered quickly as an oral solution. Another one was not included was Qulipta and Zavaprant, which came on the market just after the reported study was done. It was just too late to be discussed. Well, who made this declaration? This was a study by Yang, Liang, and Chang et al. Writing on comparison of new pharmacology agents with triptans for treatment of migraine, a systematic review and meta-analysis in JAMA in the year 2021. Well, what kind of study was it? The objective was to compare outcomes associated with the use of these drugs, lasmitamide, rimidagant, and ubrogepant versus triptans for acute management of migraine headaches. What were the sources of the data? The authors studied data sources utilizing blind randomized clinical trials for acute treatments for migraine from the Cochrane Register of Controlled Trials, Embase, and PubMed over a time frame from inception to March 5th, 2020. The analysis included 64 randomized clinical trials with a total of 46,442 patients. The age range of the patients were reported to be 36 to 43 years old, and 74% to 87% of the population was female. What was used for comparison of data? The authors used the odds ratio, it's called OR, for freedom from pain, and hereafter will be referred to as pain freedom. At 2 hours, there's the dose for data comparison. In other words, they're going to use this odds ratio pain freedom signal. What were the results of the study? For pain freedom, or pain relief at 2 hours after the dose, lasmitamide, rimidagant, and ubrogepant were associated with higher odds ratio compared with placebo, but lower odds ratios compared with most triptans. So the benefits of the new acute migraine treatment drugs studied are the triptans are good options for 60 to 70% of migraine patients and can give a headache-free data at 2 hours with that group. But there's a need for treatment of the remaining 30-40% of migraineurs who do not respond well to triptans. The CGRP inhibitors are helpful second drugs to try for successful migraine treatment in triptan non-responders. Triptans are also contraindicated in patients with previous heart disease, cardiovascular or cerebrovascular disease, or uncontrolled hypertension. And the new drugs I'm discussing here today reported had reduced cardiovascular risks and may have an effective alternate treatment in regard to triptans. So there's a migraine lament. Many persons with migraine are not diagnosed by their regular doctor and have never been given a triptan for treatment. They may have been given a barbiturate headache medicine like Fiorinol or hydrocodone, which may start a run into medication overuse headache. Migraine patients, see your doctors. Get the new drugs. Thanks very much for listening to this. And please click on like and subscribe down there, and I'll talk to you again on the next talk. Good luck.